Hi, this is Dr. Rashmi Shetty. I am a practicing endodontist and aesthetic dentist at Chisel Dental Clinic, Koramangala, Bengaluru. One of the standard routes to enhance a smile has been through braces or orthodontic treatment for a long time. Now, modern dentistry has given us the alternative of aligner treatment or invisible braces. Choosing to do invisible braces is probably the easiest part of the journey. But the questions that run through the mind as to the do's, don'ts, how to maintain it, and how to ensure the long-term result of this treatment is something that runs across all our minds. Now, during aligner treatment or invisible braces treatment, though the term sounds very easy, it does not mean that we can take the aligners and forget about it. We still have to keep in touch with our dentist, and for the treatment we place certain buttons or invisible attachments known as composite buttons. And we might also need to create some spaces in between the teeth as to where the new teeth should move into. How to maintain these? Now, for the attachments or the spaces, all we need to do is how we brush our teeth regularly. Just continue to do the same. Just add a little bit of extra here and there. That is, your mouthwash, which would have been optional earlier, is a compulsion till you finish your treatment. Also, whenever you're brushing, you use an interdental aid or an interdental brush to keep those spaces clean, and you need to still visit your dentist at least mid-treatment or once in 3-4 months to see that everything is intact, going as per plan, and as well as to get a small dental cleaning or professional cleaning done so that those deposits don't block or prevent the teeth from moving. Once these are done, now how to use your aligners. Once you get used to it, you will be able to put and remove the aligners much better than your dentist itself. Usually while inserting the aligners, we place them over the teeth, initially probably using a mirror, but then place it in, push the behind teeth first, slide it across the front teeth till you hear a snap. And whenever you change to a new aligner, you can always use some chewies, bite into it and see that they are snug and tight, and still keep in touch with your dentist. Nowadays, either through your emails, WhatsApp, and send them photos regularly to just show them that everything is fine. Now that we have seen how we can take care of the teeth, how do we take care of those aligners? Soak them in little soap water, and whenever you are brushing your teeth, at the same time also just gently brush the aligners. And say you are outside, see that you at least rinse them. Do not leave them to air dry because it will again cause bacterial accumulation, and do not leave them for too long in your car or outside in the heat or sun. And wrapping it in tissue paper and losing it is one of the most common causes of lost aligners. Unlike braces, aligners are much easier to maintain. However, there are a few simple don'ts. Like, you can eat whatever you want, but remove your aligners while eating. Do not have anything too hot or too cold with the aligners on and in place. Juices, though you can have, if they are sweetened, it is better to avoid them. And if you wear an aligner and you feel that probably you're 10 days due for your next aligner and they're still not fitting, continue wearing them for another week or so and then try on the next aligner. If still there are fit issues, we would definitely like to see you at the setup itself to check out what can be done to be corrected, or whether something simple that you can do it by yourself. Once we have achieved the desired movement, what are the things to check for? 1. Whether you are able to floss between your teeth, and when you are flossing, if you feel that the contacts are tight enough and you can feel a small snap, that means your treatment is almost done if you are happy with the position of your tooth. In some cases, if you feel that the tooth has not moved into the desired position, which is another common question and common occurrence that we do come across because it is science and not maths, what we also suggest is just do a rescan, and from that moment we can always realign the teeth to the position that we desire to. Once this is done, how to keep this permanent? This depends most commonly on the age of the patient. Every person undergoes a retention phase, whatever type of braces, aligners or technicality that we use. What is the need for retention? Our teeth are moving inside the bone and we want to give some time for the bone to harden and set around this new position of the teeth. Once we feel that the contacts are tight, the desired position is achieved, How do we maintain it is by placing either a fixed retainer or a transparent retainer. Which one to go for? The treating dentist is the better judge of it, and also it might be that you might need both of it for a certain period of time. Fixed retainers are placed on the inner surface of the teeth and are invisible again and are quite easy to maintain, requiring only your regular monthly visits, which will help in your cleaning as well as checking that everything is fine and running fine from your end. That's all about the maintenance that is required to continue it for long term. See that you visit the dentist once a year, or even if you are outstation, see that you visit any dentist once in 6 to 8 months, so that even if there is anything, it can be corrected at a shorthand and in smaller visits.